We can't prevent epidemics from occurring, but what we can do is have surveillance so we're able to recognise them early and to respond and to stamp them out before they get serious. We recognise epidemics when they are starting through horizon scanning, and we base our response to those on risk assessment. So around the world we know of the emergence of epidemics, and then experts look at the details as they emerge and work out how serious this is and what needs to be done to control this. WHO has instituted the international health regulations, and they require every country to conduct surveillance so they're able to identify outbreaks when they occur and to notify global authorities. Now, some countries are better than others at doing those, but even countries where that official surveillance is not so good because of press and because of social media, information about epidemics starting to occur actually comes to people really quite quickly these days, and that enables us, as the details to emerge, to work out what needs to be done to control this. Now, WHO has a network called GOAN, which stands for the Global Outbreak Alert and Response Network, and they coordinate interested parties around the world which are able to respond to these epidemics as they occur. Usually WHO will be putting together multinational teams that are able to go and to fight the epidemic when it occurs. So from the international health regulation surveillance that was going on and the assessments that were done, the global community recognised that there was a very unusual outbreak occurring, initially in Brazil, and this appeared to be caused by the Zika virus. Having learned from the experiences with Ebola, WHO convened a committee to assess the seriousness of the outbreak relatively early on in the course of the epidemic, and they, on their assessment, declared a public health emergency of international concern. And they did that really on the basis of the suspected link between the virus infection and the microcephaly and other neurological features that appeared to be related at that time, not on the basis of the infection itself, which in most cases is very mild. Now, having declared a public health emergency of international concern, that usually is the signal and galvanizes the international community to start to respond and to coordinate to the epidemic. I think the international authorities responded about as quickly as anybody could expect them to in these circumstances. We could see the epidemic unfolding, but what was very unclear at those early stages was to what degree the very serious complications that were being seen at the same time were related to this infection. And it needed sufficient evidence, really, for the committee to be able to declare the public health emergency. The first phase of the global response is underway, and this is going reasonably well, but we do need better tools. And this is where research comes in to make sure that we have better diagnostics, we understand about the vectors better, and we're able to ensure linkage to care for people who've been infected by the virus.